Good afternoon. I'm Dr. Jazz Atwal. I'm the Acting Deputy Chief Provincial Public Health Officer. I'm joined today by Dr. Joss Reimer, Medical Officer Health and Medical Lead for Manitoba's COVID-19 Vaccine Implementation Task Force. Today, we are announcing 6 additional deaths due to COVID-19. 1 from the Prairie Mountain Health Region, 5 from the Winnipeg Health Region. I want to extend my condolences to all the families, friends, and caregivers of these individuals announced today. The current 5-day COVID-19 test positivity rate is 9.5% provincially and 6.7% in Winnipeg. As of 9:30 a.m. today, 154 new cases of the virus have been identified. The total number of lab-confirmed cases in Manitoba is 27,893. Overall, our numbers are headed in a good direction, and we have started to look at the reopening process. This process started last week, and then yesterday, several options were presented for consideration. Under consideration are household limits, retail operations, and some health services, hair salons, and barbershops. Household limits could be expanded to 2 additional people, family or friends to visit a household, outdoors of up to 5 people, plus members of a household on outdoor private property, and funerals to have up to 10 people in addition to the officiant. Retail could be expanded to allow all stores to open for the sale of all products and the elimination of the essential items list while maintaining physical distancing and having occupancy limits. Non-regulated health, hair salons and barbershops could open and expanded to allow for non-regulated health services to reopen with adequate physical distancing and requirements to collect information for contact tracing purposes, and barbershops and hairstylists to reopen at 25% capacity with adequate physical distancing and requirements to collect information, again, for contact purposes. Manitoba can once again provide their input on these changes by visiting engagemb.ca. These are all on the table for consideration, and a final decision will be made later this week. I want to remind Manitobans that this will be a gradual and cautious process. We need to take our time to do this, to do it right, so we don't have to go back and forth. Opening and closing is not something we want to do. I know that people are frustrated. I know people are eager to reduce restrictions, especially businesses. The restrictions have been difficult for many Manitobans and have impacted all of us in many different ways. But we need to be cautious. We can't open everything at once. It is important to note that businesses that are not being considered at this time didn't do anything wrong. They are not being punished. We just can't open everything all at once. We will not be successful if we do that. Reopening needs to be a cautious process, slow, and I ask for your patience in this. Our current situation is encouraging, but it remains crucial that we continue to follow the orders currently in place and the fundamentals as we move forward through this pandemic. Stay home when you are sick, wear a mask, wash your hands, cough into your elbow. Stay home and self-isolate if you're waiting for test results. If one person in a household is waiting for test results, the entire household needs to self-isolate. We have to keep focusing on the fundamentals to protect ourselves, our loved ones, our neighbors, and your coworkers. We need to continue to make these sacrifices in the short term so that we can be safe in the long term. I'm now going to pass it over to Dr. Joss Reimer.
Thank you, Dr. Atwal. Good afternoon. I'm Dr. Joss Reimer, Medical Officer of Health and the Medical Lead on the Vaccine Implementation Task Force. Today, we are launching a new online vaccine dashboard that will provide daily updates to Manitobans about our immunization campaign. We want to be as transparent as possible. This shows how many doses we have received, how many have been given to eligible Manitobans, how many doses are scheduled to be given to Manitobans in the next 28 days, and a breakdown of the age and sex of those Manitobans who have been immunized. Nous voulons être aussi transparents que possible. Ce graphique montre le nombre de doses que nous avons reçues, le nombre de doses qui ont été données à des Manitobaines et Manitobans admissibles, le nombre de doses qui seront administrées dans les 28 prochains jours, ainsi que la ventilation selon l'âge et le sexe des personnes vaccinées. I would encourage Manitobans to take a look at our website at manitoba.ca/vaccine. I will also share regular updates on Twitter for those of you who are on social media from @JossReimer. Yesterday, we learned of another reduction in the amount of Pfizer that will be shipped to Manitoba. We did hear on Friday of the initial reduction that we shared with you, and then again yesterday, an additional reduction was told to us. So we have now been told that we will not be receiving our shipment next week, as we had been expecting. Our deliveries for the rest of the month have been cut in half. We originally were told we would be receiving 18,720 doses, and our new estimate is 9,360. Based on our planning, at this time, we can continue to book a limited number of appointments, and we so far have not had to cancel any appointments that have already been scheduled. But I do want to be very clear that based on our current projections, we will be using up all of our available Pfizer vaccine by February 7th if we do not receive further shipments of that vaccine. So if that does happen, we will then need to look at canceling first and second dose appointments at Supersites. But the information in front of us today that's been provided by the federal government, we do not have any plans to cancel those appointments for now. We are going to continue to monitor the vaccine shipment schedule and the information coming from the manufacturers and the updates by the federal government every day very closely. In the meantime, we want to continue to ensure Manitobans who are immunized that they will get their second dose when the manufacturer recommends it, which is maximizing the effectiveness of the vaccine. Our vulnerable personal care home residents are also our priority, and we will do everything possible to ensure that they are protected. But at the same time, we have to plan for the worst case scenarios, and we will keep Manitobans updated as we learn more and implement solutions. All of these challenges and uncertainties have shown the benefit of Manitoba's current approach, and that is why we will continue to not sacrifice safety for speed. Toutes les difficultés et incertitudes que nous vivons actuellement montrent l'avantage de l'approche que nous avons adoptée. Et c'est pourquoi nous ne sacrifierons pas la sécurité pour gagner en rapidité. Focused immunization teams are visiting 51 personal care homes this week, in addition to the 10 from last week. And we will complete the first doses at every PCH in the province by the end of this month. It does take a little bit longer for the data from immunizations that are done outside of our super sites to be entered into our systems. But we are updating the bulletin today with the most current information that we have available. We would now like to open it up to questions.
Just before we get started here, I just wanted to clarify one thing. We did announce 788 deaths. One death was removed due to a data correction. I don't have details on which death or when it was reported, but I can get those details for you later.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and two follow-up questions this afternoon. And up first from the Brandon Sun, Colin.
Good afternoon, doctors. I had a question about when outbreaks are declared over. I've noticed that on the Data MB site, the Brandon Correctional Center has listed that it's had an active case for a single active case for several weeks now, but the outbreak is still being mentioned as being in progress. Just wondering what it would take for that outbreak to be declared over.
Yeah, great question. Technically, we look at 28 days of having no cases before a outbreak is declared over in a particular setting. In Brandon Corrections there, my understanding is we haven't had cases for a period of time. We have removed them to an orange on the PRS system as well. So there is a case or a couple of cases there from my understanding, but they are contained in a singular unit, and there is no movement of those individuals as well. So, typically it is that 28-day mark.
I was also wondering about the possible new health orders proposed yesterday. A reader wrote in to ask if things like manicure, pedicure, and spa services would be among the personal service businesses allowed to recommence starting Saturday?
Yeah, so, what was proposed was barbershops and hair salons. So we aren't looking at manicurists at all at this point.
I was wondering if either you or Dr. Reimer could give some kind of comment on how operations have gone at the Easton Center Supersite here in Brandon since it opened on.
Yeah, I can take that question. So the Keystone site in Brandon opened on Monday this week, and so far I've been hearing very good news from the staff that are working there. The site has been providing immunizations in a very efficient manner, and we've been hearing that things have been going quite smoothly.
From CJOB, Sam.
Hello, doctors.
Hello.
Hello?
Could you repeat your question, please?
Yes, I'm sorry. Yes. My question was, if the elderly are at highest risk of contracting COVID-19, is there a timeline for when seniors who aren't in care homes will get the vaccine?
That's a great question. The elderly are not at necessarily a higher risk of contracting COVID-19. However, they are at a substantially higher risk of having severe outcomes if they contract the virus. When we look at the numbers, younger populations seem to be more likely to actually contract the virus. However, they much less frequently proceed to the severe consequences of it. That said, the Pfizer disruption has placed a wrench into some of our estimates, so I won't be able to provide an exact detail about when the elderly outside of personal care homes will be included, but I can confirm that they are one of our top priorities and will be included when we have more vaccine available.
Thanks a lot. That was my question. I have no follow-up.
From the Winnipeg Sun, Scott.
Hi, good morning, or good afternoon to both you, Scott Bill, Winnipeg Sun. Another data entry error today. I guess, Dr. Atwal, you said that you have confidence in the data entry system. We've had, I think, 4 now in the last week, or maybe the last 10 days. I guess it would seem to people, watching on that it's happening more often now. Is there any concern despite all the errors that have happened this month so far?
Yeah, great question. I think, sometimes there's that human error involved. We collect data. We have administrative ways of collecting that data using computers. That has to be verified by a manual process as well, and entered into another system to kind of put onto a dashboard, let's say. So, there is always that chance of a human error. I don't know exactly what the error was today. In the grand scheme of things, we've been in pandemic for a year, and I don't think there's been many errors. The error of, one count over a count of 1,000 or 20,000, I think that has to be put into perspective, and we always correct those as well. So we are trying to get information out to the public as quickly as possible. We always try to verify that information to corroborate it as well. And obviously, sometimes a mistake does get made, but these are minor issues, I think, in the grand scheme of things, and I still trust that process.
Thanks for that. Second question. I guess, can you explain to people, given that the current situation in the province still seems to be, teetering on a knife's edge when it comes to hospitalizations, test positivity rate, that sort of thing, why allowing people to congregate at households, even if it is just 2 people, it makes sense right now, given, kind of the climate that the uncertain climate that we're in right now?
Yeah, so, specifically if you're talking about having 2 people coming to your home, potentially with a new set of orders, or 2 people being allowed on your property outdoor, or 5 people being allowed on your property outdoors with a new set of orders. From an outdoor perspective, it's outdoor activity. We always talk about outdoor activities being less risky. It's that close, prolonged indoor interaction with individuals that we do have to worry about. This does eliminate some of the essential worker commentary that we had in the orders as well previously. previously. Again, just because the order does say you can do something, I think people need to understand that is still a choice. We still need to look at the spirit of the order. So we don't want people to abuse this as well. But people do need to connect. It is good for mental health. It's good to connect with family and really close friends to provide mental health supports to each other. And the intent here is still the spirit, right? The spirit isn't to have two people over every 2 hours at your house and a different two people. Try to look at creating that smaller bubble. Perhaps it's parents, perhaps it's a brother, perhaps it's a sister, and help each other out through this difficult time with the pandemic is the thought. Yes, there is some risk there, but even on an indoor basis, people can still physically distance. People can still wear a mask. So those fundamentals still apply in those situations as well.
Yeah, I guess I'm just trying to understand. I mean, you guys have drove the point home that it is household contacts that lead the way in terms of new cases, and just gatherings have been quite frowned upon, obviously, during Code Red. So I guess I'm just trying to understand. It just seems like an open invitation, I suppose, and people might view it that way. And I understand you're saying spirit of the orders, but the last time there were spirit of the orders, people were still abusing those term that you used. I mean, I'm just wondering if the benefit outweighs the risk, I suppose, when it comes to allowing even two people into a home, given how spread and how this virus transmits among people.
Yeah, it is a proposal. Manitobans still have the opportunity to comment on it through the engage.mb website, right? So commentary can still be made. Nothing is in order at this point, but I think we still have to look at, some of those connections people need, some of the help people need as well within their homes. Within the home, outside of the home, again, is low risk in an outdoor setting. So we're less concerned about the outdoor group size of 5. The indoor, I think, does pose some risk. But again, people need to make those connections. It's good, again, for that mental health. But people still should practice those fundamentals and look at the spirit of the order. This is all going to be about myself, about yourself, about every Manitoban still needing to practice those fundamentals. We are taking a slow approach to this, and whatever those orders look like, we need to continue to keep that in mind. I'm sure we all know people who are impacted by, being laid off. Their hip surgery got delayed because we had to, delay or take resources away from the surgical side and bring it into the ICU. So it's incumbent upon all Manitobans to practice those fundamentals, to ensure that, we don't unnecessarily create cases, to do those things within our homes to distance. And when you do interact with people, again, practice those fundamentals.
From CBC Radio Canada, Gavin.
Hi, Dr. Gavin from Radio Canada. Dr. Reimer, question for you. I'm still not completely clear on this. Will the Pfizer-BioNTech slowdown affect the vaccination campaign in care homes?
Sorry, can you say the question one more time? It was just a bit difficult to hear you.
Will the slowdown in shipments of Pfizer-BioNTech vaccine slow down vaccination in care homes?
So in Manitoba, we have used both Moderna and Pfizer in our personal care home campaign. We're using Pfizer within the Winnipeg Regional Health Authority and Moderna outside of the Winnipeg Regional Health Authority. Right now, there's no impact on any of our Moderna supply, whether that's for personal care homes or First Nations communities, so that will continue without any disruption. Regarding Pfizer, based on the information that we have today from the manufacturer and from the federal government, we do have enough that we will not have to delay or cancel the plans for the second dose for any of our personal care home residents. If in the future these delays become greater, we will be reevaluating everything, but this population is our top priority. We know that folks who are elderly are at higher risk of having a smaller immune response to a vaccine. So for this population, it is critical that we offer them that second dose, and we will ensure that they are given priority to receive that second dose if the supplies become even more limited.
Thank you for that. I was also looking at the vaccination dashboard, and it indicates that the number of women who have been vaccinated is more than double the amount of men. Is this an early indication of some more vaccine hesitancy among men?
That's a wonderful question. Right now, because the vast majority of the vaccines have gone to healthcare workers, the gender difference is quite notable in our numbers. That reflects more the difference in men and women who perform different tasks within the healthcare system. So most of our frontline workers, nurses, healthcare aides, for example, a larger proportion of those groups are women compared to men. And so more women have been eligible than men in the healthcare worker section. We don't expect that will continue when we enter the general population. There's no data to make me concerned that we'll see more vaccine hesitancy amongst men, but we obviously want to be thinking about that ahead of time to ensure that we have mechanisms to communicate with Manitobans to get them the information they need to make that informed decision.
Thank you. And finally, a question for Dr. Atwal. With cases in Winnipeg going down, has the spread slowed among the population of persons experiencing homelessness? And if so, what led to a slowdown of transmission in this group?
Yeah, great question. So today's Winnipeg numbers are, I believe it was 48 cases today. We still see higher activity in certain areas where homeless individuals are staying or located. So some specific things have been done ranging from a testing standpoint and to look at AIA and to help support these individuals a little bit better. We continue to refine those approaches as well. I don't have a breakdown of what number of the Winnipeg cases are specifically homeless related at this point, but work is being done on that for sure.
From CBC Manitoba, Bart.
Hi, Dr. Reimer. I understand, given the Pfizer slowdown, that why you cannot provide a timetable for the next Manitobans, the next groups to be eligible for vaccines. But why can't you release or state a list, a progression of the next groups that will be eligible after, of course, the everyone aged 80 and over, which you've already identified? Why can't you just state the list so people know where they'll be generally in the pecking order without a timetable?
Thank you for that question. I had hoped that we would provide that list for you today. I know when I spoke last week, that was one of the goals for this week, was to be able to give that prioritization list. With the changes in the Pfizer supply, all of the attention and work of the team was really focused on making sure that we had a plan in place that would still meet the needs of our healthcare workers who already had appointments booked, and that we could open up to further workers with the new numbers. So while over the weekend and over the last few days, most of our work has been really focused on the disruptions through the Pfizer factory, we do anticipate that over the next week we'll be able to refocus on that prioritization list. And so I'm still hopeful that we'll be able to have that available for Manitobans in the very near future.
Thank you for that. Dr. Atwal, this morning I reported that there was a recommendation on the enforcement side to do more enforcement at retail nodes at Garden City, at Regent, in Steinbach, in Selkirk. With the retail stores all opening fully or all of them being able to sell anything, even with capacity restrictions, what can you tell us about increased retail enforcement coming in this limited reopening that's slated to start Saturday?
Right. So, again, we have some options out there. We're going to get that public feedback. Again, orders are law. So if the orders do change, that enforcement component will be there. It has been there. In particular to what you're describing, I'm not aware of that specific article. I haven't read that. But obviously, if there are some spots where perhaps there has been some warnings issued, that does raise a flag, I would say, for the enforcement side as well. So again, the orders are there. They are law. And enforcement is always an option there for the enforcement side.
Okay, that story was based on a memo you would have read on the 12th of January. Similarly, that enforcement memo also recommended a visible presence of enforcement staff at city and provincial parks, in other outdoor rec areas, skating trails, toboggan runs, to prevent people from congregating in larger areas. Why haven't we seen that?
I really can't comment on that. I'm not on the enforcement side, and that can be directed to enforcement. I think they may be the best people to answer that question.
Able to do those, but okay, thanks.
From the Canadian Press, Steve.
Dr. Reimer, I'm wondering if you could give us some more detail in terms of numbers about how the delay in getting the Pfizer vaccine will affect the number of doses that can be handed out in February.
So what we've been told by the federal government is that we can be expecting in total so far just over 29,000 fewer doses than what the original allotment was. They have confirmed that our shipment next week, which is part of that 29,000, will not be coming. And after that, they're actually still evaluating our next two shipments to be able to determine exactly what numbers we can be expecting from those next two shipments. So I don't have the exact numbers, but I can also go back to some of our planning folks and get a better estimate for you after this.
Okay, thanks. Dr. Atwal, I've noticed in browsing through the weekly reports that many people are reporting zero contacts. Many people who have been tested positive are reporting zero contacts. Now that we're going to allow some social interaction inside private homes, is it fair to expect that number to rise somewhat, and what might the impact be on the demands on the healthcare system?
I mean, this will, if the orders do change again, and this will depend on how Manitobans behave. Let's say, for instance, I'm at home, the orders do change, and we have a person over. If we're able to distance 6-7 feet on a regular basis and not touch or hug or share food items, etc., even if I had COVID, technically they wouldn't be a contact, right? So again, we can have some of those interactions, but the onus is on the person. Both individuals to ensure that, they're able to do those things to protect themselves. And if they practice those things, if they do those things, if they distance, if they wear that mask, if they don't share items, avoid the hugging, etc., that really limits those contacts. Now, granted, obviously, as we allow more interactions between people, this virus is about interactions. The more you interact, the more ability you have to interact. I think we will see some added cases, and we are prepared to manage those cases. How that impacts hospitalizations, it just depends on the number of cases that we produce or Manitobans produce. So we are taking this slow. We are going to take a look at it, on a day-by-day basis. If the orders do change again, they're going to be in play for 3 weeks. Before they're sort of reassessed, but in general, we do reassess what we've done on a daily basis, on a weekly basis. So we're going to look at those testing numbers. We're going to look at test positivity. We're going to look at the movement of individuals, enforcement information, hospitalization information, case and contact investigations, determine what transpired from a change in orders, and potentially what should we do in the future or what shouldn't we do in the future as well. So there's a lot of variables there, but again, I'm going to put it back on Manitobans. This is up to you. Manitobans need to practice those fundamentals. We all do.
And my final question is on the test positivity rate. We see it's dropping. We see it's dropped quite sharply in Winnipeg, still relatively high, but down significantly. What's the test positivity rate in the northern region where, case numbers are still very, very high per capita?
I don't have that information. We typically provide case positivity numbers for the province and Winnipeg. Those denominators are big. When we're dealing with smaller denominators or smaller populations, we tend not to provide that because it could impact that community as well. But I think the number of cases and knowing the population in general, the numbers for, let's say, the Northern Health region, it's higher. Right, so we definitely have a lot of cases within our northern population in certain areas, and that is impacting some of these numbers, obviously.
From CTV Winnipeg, Michelle.
I just wanted to start to ask about the vaccination dashboard. Can you explain kind of when and what that will be updated with? and where the information shortfalls are. Like, will we not be getting northern information on there, or what won't be there?
The dashboard is going to be available and updated regularly every day as our data comes in. So we want Manitobans to have access to that information in the same time frame that we on the task force have access to that information. There are many limitations to the data that we have available. One of them being that we know that for more isolated communities, there is always going to be a delay in reporting. For example, some of our smaller teams that go into these small communities may be working in locations where there is no internet access. So rather than being able to directly enter data at the point of administration into our computer system, they instead have to collect that separately and send it to our data analysts for entry after the fact. And indeed, it's essential that we prioritize the work of those teams in first putting those vaccines into arms before they worry about sending the data to us, because the top priority is getting vaccines to the people who need it. But when it does come to reporting for Manitobans, it means that there will be a delay, often several days of delay for that information to get to Winnipeg, to be entered into the system, and then be verified by our team that looks at that data every day. That also is a challenge when it comes to personal care homes. When you're moving from room to room, it's difficult to be able to do that real-time data entry as well. So we've also asked them to provide their first priority being the administration of the vaccine to residents, and then the second priority being getting the data to us. Additionally, not all of our personal care homes have internet access either, so that can delay it as well.
Okay, great. And also, I have a question about the vaccine dispersion. We know we're not getting as much in our shipments, but does that mean that when you start sending it out to the Supersites, Brandon and Thompson, will they get lower shipments as well, or would it be concentrated in Winnipeg where there's more people? I'm just curious about how many will go to each Supersite.
That's a great question. We have reduced the allotment for all of the sites as far as what they receive because the eligibility criteria applies to all Manitobans, and so proportionately in each area of the province there will be fewer people who will be eligible because we can't expand those eligibility criteria as quickly as we had hoped. I can also clarify that for Thompson, we have decided temporarily to use Moderna instead of Pfizer to ensure that we do get doses to that area, particularly in response to the higher numbers we're seeing in the Northern Regional Health Authority. So rather than delaying the opening of that site with this disruption of Pfizer, we're now temporarily going to be using Moderna there so that the disruption does not have an impact on the opening of that site. In the long term, assuming that the numbers return to where Pfizer is currently stating they will be returning to, the Thompson site would be using Pfizer simply based on the transportation and storage requirements that make it a better hub for the more complex requirements of Pfizer.
Okay. Sorry. My last question is, we know how many Pfizer doses we're expecting. Can you tell us how many Moderna doses you're expecting and when you're expecting more of those?
I don't have the exact schedule of the Moderna shipments in front of me. Typically, we receive about 7,000 doses every 3 weeks, but that is not the same for every shipment. That is just the typical allotment that we get once every 3 weeks.
From City News, Jonas.
Good afternoon, folks. Dr. Atwal, first question for you on what's happening up north. We've had a lot of new cases over the last 10 days, and these are going to start hitting home with hospitalizations, ICU admissions. What is capacity for the northern region for beds, whether it be Thompson, that area, and what are the plans moving forward to ensure that folks are transferred if need be, or what's going to happen there?
You know, that's a great question. I can answer probably some of this, and some of this might have to go to shared health as well. I mean, today's numbers, we had 70 cases in the north. You know, about 48 of those were First Nations Inuit Health Branch related to a few communities where there is outbreaks occurring. You know, these aren't brand new outbreaks, so we've had cases there for a period of time. Obviously, that does generate some hospitalizations, and those people typically, you know, depending on their service area, some of them come to Winnipeg, some of them come to Thompson. Obviously, if they need a greater level of care, they're typically brought to Winnipeg as well. So there is capacity in the Thompson Hospital to manage COVID clients. You know, there's capacity in all of Manitoba's hospital to manage COVID clients, but if we're looking at more advanced care, more you know, intensive care type care, each hospital can do that, but typically most individuals are brought to Winnipeg for that. So, I mean, there are discussions every day on hospital capacity. Obviously, our ICU numbers are down, our hospitalization numbers are down. Staff are still there in those areas available and will continue to be available. And obviously things change day to day, but you know, the comfort level is there knowing that the system has capacity to manage cases and whether they require hospital or not, or just alternative isolation as well. And we have a good team of individuals on the ground within these communities. So not just federal workers, you know, federal nurses. We have provincial nurses on the ground. We have physicians on the ground, and we have you know, tribal council nurses. It's a really all hands on deck approach in some of these communities to help mitigate the spread of COVID-19 and manage clients as well.
Thank you for that, sir. Dr. Reimer, one on the initial, I guess, rollout of the vaccine so far in Manitoba. When we first, you know, kicked off, we've only outlaid, you know, 5% of what we got. Now, you know, we're maybe seeing that's prudent. Maybe just a message on the vaccine rollout at the start and what residents should expect to see, and just like how massive of scale this will have to be.
So this is the largest vaccine campaign that Manitoba has ever done. The numbers are far greater than any other type of vaccine we've used, and with a more complex product than any previous vaccine campaign. So, for example, when it came to H1N1, we provided just under 700,000 doses of the H1N1 vaccine to Manitobans. This time, if we're assuming, you know, about a 70% uptake, we're looking at 1.5 million doses. So that, combined with the complexity of the current vaccines that are available, make it a far larger and far more complex program than anything we've seen in the past. And you know, I'm really proud of the team and the work that they did initially to open up at the Rady Centre with, you know, only a few days' notice from the government that doses were coming. We originally thought that the doses would be coming in January or February, and when we were told that we should be expecting doses to show up in a few days, the team put in so much effort and so much time in making sure that we had a clinic that was ready to go to provide things in a safe and effective way for our high priority healthcare workers, you know, within days. You know, I've heard from many people who went through that clinic about how well things went in that initial pilot. And then to be able to open up a super center so quickly after that is also wonderful for the long-term plans for Manitobans. The super center has the ability to expand. You know, we're only using one of the 3 floors in the convention center, for example. And so it's a well thought out plan where we can provide a very efficient mechanism to get a lot of doses into Manitobans and can quickly expand with the staffing that's already applied when more doses become available. So we have done things in a way that is you know, extremely fast, but also safe. We wanted this to be done so that Manitobans could feel secure, that they will be coming to a clinic where they are protected, where they're not at risk of being exposed to the virus itself, and where they'll be getting a reliable product as well. And so we will continue to do that as we work with the current disruptions. And as we work with increased doses that we still expect to come in the near future, we do want Manitobans to see that we're going to have safe, effective, and fast clinics available to them in a variety of locations.
Thank you for that. Just as a follow-up, if we had handed out maybe more doses initially to folks in personal care homes or folks in at-risk communities, what would be happening right now if we didn't have doses as backup?
Yeah, we've seen in many jurisdictions that the really difficult challenges in making some of these decisions about, how much and how quickly to send out all of the vaccine doses. When we're thinking about inventory, we do always want to have some safety stock available. That means that we can have enough to run the clinics that we've planned. So while Manitoba is not saving doses in freezers for the future second dose, we are ensuring that we have enough in our freezer that the appointments that are booked in the upcoming week, that we can fulfill those even if our next shipment doesn't arrive. And that plan, that safety stock, even though it's only for a week or 2 weeks, has meant that we so far haven't had to cancel appointments. And so far, everyone who has signed up is still eligible to come and receive a vaccine. And same thing in our personal care homes. So far, we have no indication that there'll be any lack of supply when it comes to the second dose. So this is always a difficult challenge because there's pressure from what we want as the task force to get needles out as fast as possible, and from Manitobans to get needles out as fast as possible. And we have to balance that with the safety of Manitobans at the same time, and the logistics of making sure that our clinics can run efficiently, rather than having the confusion and challenges that can come with having to cancel and rebook appointments.
From CHVN, Taylor.
Hi, good afternoon. Dr. Atwal, I know we talked a little bit about this yesterday. We're hearing from people who believe the decision to not open places of worship is primarily based off of survey results. Can you clarify how much of a role that survey played in this decision and what other factors health officials were looking at?
I think every bit of information we have plays a role in where we make our recommendations and take those orders. A lot of it is dependent on risk. So when we know we've had super spreader events happen because of places of worship. It's not all of them. It's happened. It's not just locally here. It's in other locations as well, other provinces, other countries. So we do take that into account. Again, having a lot of people in a closed environment, in an indoor environment where it's hard to physically distance per se, or some people will be less inclined to physically distance, poses risk. And again, we've had some of those issues there. So I think, from a public health perspective, we knew there was risk there. We've always said there's risk there. And I think, the survey results, I don't remember the numbers off the top of my head, but there are some priorities, and we just can't open everything up either. Right? There are limits to what we could open up. We looked at low risk activities, and we wanted to look at that connection between people, between families, perhaps like in a small bubble. We're not calling it a bubble, but that's sort of the spirit of what we like to see happen. So we decided to go the route that we did.
And you mentioned that you saw instances of the virus spreading in places of worship, but right now we don't really have an idea of how many times that happened. Can you tell us more about instances of COVID-19 spreading in places of worship here in the province?
I don't have details of that on me at the present time.
And how high on the priority list is it to reopen these places of worship?
Again, I think we're going to take a look at this slowly. We're going to be very cautious, and we're going to, look at this, as these orders change. We talked about a 3-week period for these orders before other orders are looked at. A lot could happen in 3 weeks. I think we've seen that with this virus, and we're not going to speculate on the future at this point. We're going to focus on what we need to do right now. We're going to ask Manitobans to continue to focus on, behaviors and making sure that they're doing what they can to protect themselves, protect their families, protect their communities and their coworkers as well.
From the Winnipeg Free Press, Carol.
Hi there. I have a question about planning for Dr. Reimer. Just getting back to what you were saying, Doctor, about planning and having the short notice about when the Pfizer vaccine would arrive. It came in mid-December instead of February, so the preparation time shrank from like 6 weeks to 4 days. So I'm just wondering, how is it possible that the province hadn't already undertaken all the necessary planning long before that notification from Ottawa that the vaccine would arrive in mid-December? How come this isn't something that could have been done sooner Was it a lack of resources? I don't understand.
So, we have done planning since the spring. So our public health department has been working right from the beginning of the pandemic on looking at our existing infrastructure for vaccine rollout and trying to imagine a variety of different scenarios in how we would need to change that in response to a COVID vaccine. In the fall, when we started to get a better idea of which different manufacturers were looking to be front runners as far as availability, we needed to focus that in. And that's when the task force really ramped up and started doing substantial planning on a variety of different scenarios. I think the biggest challenge to being able to have a plan that was ready to go at that exact moment was not knowing which vaccine was going to become available. We heard that Pfizer was being reviewed by Health Canada, but we also know that Health Canada is currently reviewing AstraZeneca, and we don't know if or when they'll be approved. The requirements for AstraZeneca are extremely different from Pfizer and Moderna, such that we will be able to use a lot of our existing infrastructure that we do for our flu campaign. So, for example, AstraZeneca can be stored at fridge temperature. Most doctors' offices and pharmacies don't have freezers to be able to manage the Moderna and Pfizer products, but they do have fridges that are monitored and could manage something like AstraZeneca. So while we had many different scenarios lined up and we're planning for all of them at the same time, until we knew which product was going to show up, we couldn't have the final preparations in place. So the surprise of getting it many weeks earlier than we had initially thought just meant that we needed to focus in on that specific scenario and get everything on the ground and ready to go for that scenario for that vaccine, as opposed to having multiple plans ready for multiple vaccines.
So in your vaccination implementation task force planning meetings, who from the Emergency Measures Organization was at the table and what was their involvement?
Emergency Measures Organization is involved heavily in the COVID-19 response in all aspects of our work. We work very closely with them. They sit in with our meetings. We have regular work with that team. So they are an integral part of government's response and planning and will continue to be so as we go forward.
Does the task force have the resources, whether it's planning or management expertise, that it needs to address issues at the vaccination supersite of the convention center? We're hearing concerns about disorganization, a lack of instruction on the procedures to follow there, a lack of staffing and coordination when people show up for their first shift. Can you comment on that?
There has been a lot of work that has gone into the coordination and running of the convention center. Truly, through our system, we're not hearing about any major concerns for the staffing, for the training, for the preparation of the team there. The colleagues that I have who have gone through that super center have spoke quite glowingly of their experience there, which is something you don't often get to hear when you're thinking about healthcare, wait times in clinics. And so that was really encouraging to hear from the folks that I know who have gone through the clinic about how smoothly their experience was. Likewise, the staff that we are working with every day have told us that they feel very well supported. We have created training programs that look at a variety of different things around each individual staff member. Because we've expanded the eligibility for immunizers so substantially compared to pre-COVID times, we know that we have staff who have a variety of levels of experience in providing vaccine in general. And so we have divided up the training into a few different considerations. First, we consider whether they are retired, whether they're a student, whether they're someone who has their credentials from outside of Canada, or if they're a member of our existing workforce. That helps us to frame where they fit into the training requirements. And then additionally, we look at who are those people who have never been part of immunization programs in the past, who are those people who have participated in immunization programs but don't necessarily work with our information systems, so that's our Public Health Information Management System, or FIMS. And then who are those people, like our public health nurses, who regularly give vaccines and regularly enter into FIMS. And then we have 3 different aspects of training that depend on those backgrounds. So for some people who have, no previous experience in immunizing, we have that micro-credentialing course through Red River. And so that ensures that they get trained in how to provide the vaccine. They're trained around some of the cold chain aspects that are unique to this vaccine. And they also get trained in the FIMS system so that they know how to do data entry. For those people who are familiar with FIMS and familiar with immunization, they need much less. They just need, a quick instructional period on the specific information around this vaccine that differs from the vaccines they've used in the past. And of course, those people in the middle need, something in between those two. And then once we have our staff showing up on site, we always make sure that we have a variety of levels of experience available at the same time. So some of our immunizers will be new, and some of them will be our most experienced public health nurses. And so that support system is available. We have clinical leads who are available, and we make sure that we're checking in with our staff regularly, that they bring concerns forward to the leadership, and that we can give them that feedback and that assistance throughout the day, whether it's their first day or their 100th day.
From Global News, Joe.
Yes, hi there. I'm just wondering when we can expect to know for sure if Pfizer shipments will be made by February 7th.
Yeah, that's really a question for the federal government and for Pfizer. We are talking to the federal government every day. So far, they haven't given us any final numbers. They've just told us that the future shipments are being looked at. So the only confirmed information that we have as of yesterday is that in addition to what we heard on Friday, next week's shipment will not be arriving. And in fact, no shipments will be coming to anywhere in Canada from Pfizer next week.
Gotcha. And just to be clear, I apologize if this was already mentioned somewhere, but all of these scheduled shots over the next few weeks are already in the province. Is that right? Or are we still waiting for doses to arrive to fill those appointments over the next few weeks?
So we don't withhold supply to ensure that every single booked appointment going weeks into the future has something sitting in a freezer. Like I said, we don't hold back, for example, for a second dose appointment that gets booked 3 weeks in the future. What we do is we make sure that we have enough supply on hand that we can complete everything that we need for the existing week and then for the future week, because we don't know if the shipment might be delayed by a few days or even by a week. So we always have enough for the clinics that are booked for the existing week, and then we have enough for the week that the next shipment is supposed to arrive, because we don't know when exactly that shipment is going to arrive, even if it's not delayed. The federal government doesn't guarantee us a specific day. They tell us the week that we can expect the dose to arrive. So what we know today, and based on the numbers we have today, we will, with the future shipments, have enough to complete all of the currently scheduled first and second dose appointments. If we do not receive any further doses of Pfizer, then we'll need to look at potentially canceling some of those future appointments.
Okay. And again, with the vaccine, how big a role, if any, is the vaccine rollout impacting our reopening or easing of restrictions plan?
Well, that's, the whole point of the vaccine campaign is that we're excited to see Manitobans start to build up immunity to this virus so that we can change some of our public health measures. Right now, with the very small supply that we have, the impact on what we call herd immunity or the protection that we have from each other when some of us are immune, we're not anywhere close to that. So for today, our public health measures are using the assumption that the immunity level in the community is still very low, and the vaccine is not changing how those decisions are made today. But that is absolutely the goal as we move forward. The more Manitobans that are immunized, the lower the risk it is to all of us. And so, we'll be working very closely with myself, Dr. Atwal, Dr. Rusin, to make sure that we're taking a look at how many Manitobans are immune, and how can we balance those risks as we go forward in our decision making around public health measures.
Thank you, everyone. This concludes today's media briefing.